Well, I'm an ex-cop, and years ago, when we went through the academy, we learned how to use first aid equipment and all that. The problem is it was 40 plus years ago. So, you know, a lot's changed. Back in the day, they told you if you use a tourniquet, you're nuts. Well, today they've kind of graduated to the point where, you know, lose the limb, save the life. You know, if the patient exsanguinates, you know, what have you gained?
Not much.
So that's one of the things we wanted to talk about was the combat tourniquet kit. We have a gunshot trauma kit here. It has something in here called a chest seal,
Okay.
which I actually know very little about.
Okay.
So we came to the guys that are the masters that do this for a living. Yeah. So,
That's a nice kit you got there, it looks like.
well, thank you.
Are we shouting out Sunshine Safety?
Absolutely, absolutely. We can shout.
I met
out.
them at the Miami Gun Show.
Yeah, that's where we met them too, and they were really cool with us. They talked to us, which, I mean, you can see me. Would you really talk to me?
I did.
Oh, I know, that's a scary thing. Okay,
I have low standards.
Now, I did have a question right off the bat. Little Sharpie pen.
I love little pens.
Why would you use that in a first aid situation?
It's adorable.
Mm-hmm.
And when you apply that tourniquet that you were talking about,
Uh-huh.
you can document the time and date that you put it on.
Okay, which can be very important.
So the surgeons are going to want to know that information, and that's why they include it in there.
Makes sense.
And also, they recommend, the American Heart Association recommends, if you have an amputation,
Uh-huh.
you put that bag, you put the amputated body part in a plastic bag,
Uh-huh.
and then you put that bag into a bag with ice, so it's not directly on the ice, and you label the bag with the person's name and the time and date.
Okay. Well,
So
makes
that way
a lot
when
of
it gets to
sense.
the hospital, they know who to attach the missing body part to.
So take notes is a good thing.
Taking
That's not
notes is a
just
good thing, so
something
there's your
knowledge.
Sharpie marker.
Yeah, fantastic. All right, so that explains that. I'm glad we talked about that because that's
Would
kind
have
of
bothered you.
important information. Yeah, well, you know, I mean, a little pen for no reason is good to see. All right, so this is a combat tourniquet.
It is.
Yeah. And this would be used like, well, maybe I should say the reason why this is important to me. I have a cameraman, we go out to the range, we shoot guns all the time, and it's unlikely for him to be shot because I'm kind of a stickler on safety. But
Right.
it's never zero. The chances are never zero. It's always a possibility, so you need to be prepared. If you get shot in the arm and you nick a major artery, it takes very little time to exsanguinate.
It does,
So
and it can be within minutes.
it can be, yeah.
And so I teach a lot of first aid classes, and I do this professionally as a firefighter paramedic. And even we take it to the most extreme, being your military and police history. We always think of the gunshots. We think of the mass shooter incidents, the gun range. But these tourniquets are fantastic for fishermen, mountain biking, campers, guys that go on long hikes. They fall, they hit a branch, and they're bleeding uncontrollably. They're fantastic for anybody who really cares.
Yeah.
And a lot more police officers in 2024 are carrying them than I've ever seen before. Whether it be the CAT tourniquet, the SWAT T tourniquet, most of them have some form of tourniquet with them. And for the exact reason you said, it's not likely that you're going to shoot your cameraman, depending on the day, I suppose, but
Well,
please
mainly
don't.
depending on him and the things he says, but you know.
But accidents do happen.
Right.
And it might not be us, it might be the group next to us where an emergency happens, and at least you have the supplies available for that.
Right.
And you would be surprised how many guys at the gun range, girls at the gun range are police, fire, military, that are willing to help in those situations as well.
Yeah.
Having the right stuff is huge. I keep one of these in my bag, and I might have one open that we can, so that way you can keep yours sealed.
Yeah, that's always a good
But
thing.
yeah, we'll definitely talk about the CAT tourniquet. If you want to pass me that one right now. This is a trainer here
Okay.
that I had. And some of them come in a nylon case like that, what have you. We make a giant mess here. We can pick this out, I think. And we'll open this one up because I train with these quite a bit. And when are we going to use this? We're jumping right to the cat tourniquet. Most bleeding is going to be controlled with direct pressure.
Right.
You know, you nick yourself shaving, you put a piece of toilet paper on it because it's the closest thing to you. And what's the normal guy thing to do is we take it, oh, yep, still bleeding, still bleeding, still bleeding, versus just keeping pressure on it. If we keep that pressure on for 5 minutes, the bleeding stops. So direct pressure is always the first alternative to a tourniquet. Uncontrolled arterial bleeding that is not controlled with direct pressure, then we would consider this. Where are we going to be able to use this? On the extremities.
Right.
Legs, arms, and not in the creases. So if it's in the armpit, you're not going to be able to use this. If it's high in the groin, if you've seen the movie Black Hawk Down when they were reaching in trying to clamp the guy's femoral artery.
Yeah, you can't get to it.
Exactly, that's where you're going to use a packing agent, like the quick clots and things of that nature. For that instance, tourniquet really wouldn't be appropriate, but most of the manufacturers recommend going a couple inches above the injury in an oh crap situation, high on the arms, high on the thighs, and you can figure it out later.
Right, right.
So most of them have the running end of the Velcro, your windlass, and a spot. And if you look right there, we have our cameraman that can zoom in where there's a spot on the tourniquet that tells you to label the time when you put it.
Right.
And now you know that you're going to take that Sharpie marker and mark the time. So,
Magical.
so when you use this, keep the red end facing towards the heart. If I was to put this on myself, which is obviously the most difficult way to do it,
Right.
pull the slack out, wrap it around as best you can. Try to get as much Velcro making contact. And I left this in the way. My microphone's in the way too. And then you're going to crank on this windlass until the bleeding stops.
Okay.
Once that bleeding stops,
You're going to hook it in.
you're going to hook it in.
Right.
Ensure that the bleeding has stopped. This prevents that windlass from coming out. This could be a casualty that we're moving. If it was a police situation, this is going to stay on until they get them to a medical treatment area, a SWAT medic team, something like that. They're going to reevaluate this, ensure that the bleeding has stopped below this, and get that person to further care.
Right.
Whether it be an local emergency department is going to be the greater care.
Right.
These will open up pretty wide. I got pretty thick thighs. So they'll open up wide enough to go around the thigh. And they are absolutely fantastic.
So theoretically, I could wrap that around my cameraman's head and keep tightening it until he got smarter.
Not recommended by the American Heart Association. I don't know if it increases intelligence, but it would, you know, some people are into weird things. So.
I would think it kind of would increase intelligence in a way because he would probably not want to have that thing on his head twice.
No, you would not. And in the firefighting world, in the paramedic world, I personally haven't used these a lot. The likelihood of needing the tourniquet is pretty rare. I've had cut wrists, I've had cut amputated body parts. Most of them can be controlled with bandaging. Simple ACE bandages, Israeli bandages. I have one over there we can show you. That is fantastic, and most of it can be controlled with that. But this, their recommendation from the manufacturer, 2 inches above the injury and tighten until bleeding stops. Pretty simple.
Yeah, makes sense.
Even an officer can do it.
Well, there you go. You know, we were making jokes about this, but this is actually a pretty serious thing. If we ever do have to use one of these, and God forbid we do, it's good to know how.
It is.
Because honestly, like I said, back in the day, when I went through the academy, they were really big on saying, don't ever use it.
Yeah.
But, you know, my thinking was, you know, lose the limb, save the patient.
Save the person, and with
Yeah.
modern medicine, they have the ability to save body parts
Yeah.
a lot more readily than they did in the past.
Yeah.
Science has evolved. I don't have specific time frames of how long you can leave that before you lose a body part. I'd be lying if I said I did, but most of the bleeding that can be controlled, and then if it is the emergency situation where, okay, maybe we went a little far with the tourniquet, and I've seen this in my professional career. People put a tourniquet on and the guy's not bleeding much.
Yeah.
They kind of jumped the gun and went straight past every other bleeding control method and went right to the tourniquet.
Right.
So as a paramedic, I can reevaluate those things and go, okay, we don't need a tourniquet. We'll be
Yeah.
okay wrapping this up.
So as a rule of thumb, I should look at first direct pressure,
Yep.
then a bandage, and if none of that works,
Direct pressure elevation
Uh-huh.
can help.
okay,
I don't think it's been shown to help as much as they think it did, but direct pressure, elevate, and then if bandaging does not control it,
then we worry about
then we worry about a tourniquet. Yeah, and this is gonna be typically your bright red arterial bleeding.
Right.
It's gonna be spurting out like a sprinkler every time the heart beats, spurting out bright red blood.
Yeah.
And it's gonna be scary.
Yeah, yeah,
And that's why people jump to a tourniquet and use it early, I get it. I don't wanna see any of my blood on the floor.
yeah, me neither, I kind of.
But everybody that goes to the range, in my opinion, should have one of these in their bag.
Yeah.
If it's not for yourself, it could be for the person next to you to help them.
Even if it never gets used, it's a good thing to have.
Well, and that's why a lot of officers carry them because, again, even if they're not using it on themselves, they can use it on their partner, they can use it on another agent from a different department, etc. So
Yeah.
the cat tourniquet, most of them have it right on their holster, or they'll use a different brand name.
Yeah, I've seen a lot of officers carrying these recently. I think a lot more are doing it now than used to,
Absolutely.
but, yeah.
You guys are the first ones there.
Yeah,
I know the joke in the police community is that the firefighters are second responders, because you guys get there and make sure that the scene is safe. So that's the big joke in the police versus firefighter conversation.
Yeah.
And that's why a lot of the officers in 2024 carry Narcan.
yeah.
A lot of departments have gone to where the police officers carry Narcan. They show up, the guy's unresponsive, there's a needle next to him. They suspect that they did some type of narcotic and they can give the Narcan away.
Yeah, yeah, well, that makes sense. You know, I always looked at it this way.
Nice gloves you got there,
Well,
too.
thank you, I was gonna get into those in just a second. With you guys, the way I always looked at it is, I know a little bit about first aid.
Mhm.
You know a lot about first aid. I would rather have a guy that knows more about it not get shot,
Yeah.
so that he is more useful, because if he's got to worry about saving his own life, then whoever else has been shot. So you're important to us.
Well, thanks.
I mean, it's a big joke. Yeah, the firefighters out of the cop. Yeah, it's a big joke.
Right.
But honestly, I've always considered us to be brothers.
Yeah, we both have a job to do. They're very different jobs, but to accomplish a similar goal.
But it's necessary.
Oh, absolutely. We
Okay.
depend on our cops for a lot, so
Yeah.
we have a good relationship where I work with our officers. I know the officers on scene. I can always walk up. They give me a lowdown. Hey, this is what's going on with this person. And at the end of the day, between the two of us, we try to mitigate situations in the best way possible for everybody. You know, PR in 2024 and public perception is huge.
It is huge.
Especially when you're dealing with law enforcement officers who, it's funny, you see 10-second clips of an officer doing something quote unquote negative, but they don't show the 2 hours before that the person was trying to do everything they could to benefit the person that they're there with.
You know, there's other things. You go to an accident and you find an infant in the back of the car is deceased.
Yep.
And the mother asks you, I was 19 years old, this actually happened, and the woman says, where's my baby? I'm 19 years old. I don't have any clue what to tell her.
Yeah.
All I could think to do is say, we'll take care of it. And that's all I said. I just kind of,
We're doing everything we can.
I didn't know what else to say.
Yeah, and
I was
that's,
brand new on the job, and so, what do you do with that?
yeah, this is one of those nightmare situations.
And if you think that doesn't get in your head, I mean, it really gets in your head and it screws you up for a long time.
Oh, that's a whole other
It
conversation.
really does.
We could probably talk about that for a couple
Oh,
hours.
for
and
hours, yeah.
PTSD and the fire, police, military
Yeah.
atmosphere, and you know, we all have our ways of coping with it.
So imagine you go through that and the next guy you talk to gives you a load of garbage. I mean,
What do you mean?
really gives you, calling you names, giving you crap. You just want to kind of gently, or not so gently, reach over and chuck the crap out of the guy.
You know, it does
And
take a
you-
lot of self-control.
And you can't.
No.
So,
That's why you can say whatever you want before the call, you can say whatever you want after the call, but
yeah.
when it's go time, you got to put on your game face and
Yeah.
do what's best for everybody. And that's why, like I said, I try to do the best for my crew, the police officers with me, mitigate the situation, and then I can go deal with it afterwards.
Right. So, we have some gloves in our little kit here.
Those are adorable.
Aren't those cute?
Those are. That's the
Yeah.
smallest set of gloves I've ever seen in my entire life. I'll give you a better set before you leave.
Okay, cool. Yeah. I mean, they're better than having nothing, because you never know.
These are probably not much better than having nothing, because these are probably going to cut, but I get it.
Yeah. Whenever you're
Um,
dealing with bodily fluids, there's always a chance of bloodborne pathogens, things that we don't want to take into our own bodies. So you want to do something to cover.
Absolutely, yeah. See,
Yeah.
so these are pro level gloves.
Mhm.
You
Yeah.
can see the difference
Oh, a lot heavier.
in the size that these are going to take up.
Yeah.
Most first aid kits, they try to keep it tight for a room, so I made the
Right.
joke about them.
Yeah, but they are cute.
They are, but you want to keep their stuff off of your stuff.
Yeah.
I don't want to get anybody's fluids on myself.
Right.
We wear gloves, eye protection, masks for all of our calls. But in a first aid situation, if you're there helping somebody, the chance of you actually contracting something and you don't have any open sores on you is
It's
slim to
low.
none.
Right.
But best practice is to wear gloves. If you get something on you, you have intact skin, you didn't cut yourself shaving today. You don't shave all that often, I don't think.
Once every 100 years. I try to keep it to a minimum.
Yeah, but the chance of you contracting something from your intact skin, blood, whatever that fluid from the body may be is pretty slim.
Yeah.
Glove up, wear them
Yeah.
whenever you can.
Yep, absolutely. So we have a product here called a hemostatic gauze dressing.
Hemostatic gauze dressing, let's not waste that. They impregnate this
Okay.
with a chemical, I don't know exactly what chemical. So they say it's a soluble regenerated cellulose for bleeding control. It helps the clotting process.
Right.
Long story short, the hemostatic agents, and in the military, and actually mostly in the military, it's actually in a powder form
Yeah.
that they can actually put into the wound and deep. And I know that the surgeons hate it because it's hard to clean out.
Yeah, I would imagine.
So the surgeons absolutely hate it. Most of these gauze dressings now, they have it impregnated into the fabric itself. So when you take this and place it into a wound, and when I say into a wound, the example I gave earlier, the Black Hawk Down, bleeding femoral artery, that's the type of injury where this is going to be used.
Yeah, and you're just gonna stick the whole thing right into the hole.
Stick it in as deep as you can, and then bandage over the top of it. And that's where a lot of the Z-fold gauzes come into play. I don't know if you have one in your kit or
I
not.
do, yeah.
They usually vacuum seal those as tight as they can.
That's not it. That's it, right there.
Yeah, these Z-fold gauzes, it's just a compressed gauze. Your normal 4x4 gauzes, this is in a cooler format that you can actually push into the injury itself.
Okay.
So the compressed crinkle gauze, they call it, and different companies call it different things. And the hemostatic gauze into the wound. This
So-
is your groin injuries, your abdominal injuries, potentially a chest injury, where you can place this into the wound. That helps with the clotting process. Direct pressure, again, is hugely important. So we stuff that injury, that hole that was created by blank, maybe a 12-gauge shotgun,
Could be anything.
could be anything. Pack this into the wound, and that's why these Z-folds allows it to come out easily. So you hold it in one hand, stuff the injury with the other, and then you can really hold pressure on the end. Yep.
So would you put in the hemostat dressing first and then the?
Correct.
Okay.
Yep,
Okay.
you want this as close to the injury as you can. Good thing it's not expired. Good
Right.
job, safety. Who was it? Sunshine Safety.
Uh-huh, yeah, they did a nice
Shout
job for
out,
us.
Sunshine Safety
Yeah.
has this in their kit.
Yeah. They also have a chest seal here, vented, it says. Now, I
A
don't
vented
know,
chest seal.
I don't know anything about this.
You don't know about sucking chest wounds?
Some about it, but not.
Some
not a lot.
about it?
Yeah.
So you'll see at the end of the table, let me see, you see a petroleum gauze over there?
Yeah, we got
Or
one.
Vaseline gauze? I think we have one over there. We can always cut this too.
Yeah. This is where.
I thought I had
everything
one.
comes
No,
from.
there's a Vaseline gauze over there. Yep,
There we go.
there you go. So back when I did EMT 100 years ago,
Uh-huh.
we had petroleum gauze. So you had a sucking chest wound, a penetration into the person's chest, and the complication was that with that is it would take air into the chest cavity.
But not into the
And,
lung.
huh?
But not into the lung.
Well, it depends what part of the chest is damaged. The problem with a sucking chest wound is it can actually cause a pneumothorax, put pressure on the unaffected side, so extra air coming in from the outside is a problem. You don't want that.
It holds the lungs so they can't expand. and
It
take
puts
it in.
pressure on the lungs, it puts pressure on the heart, and will cause narrowing pulse pressures, cause trouble breathing, all of those things. So the petroleum gauze that we learned in EMT school, you would open this up and just use the foil itself, place it over the hole, tape this on 3 sides,
Okay.
and that allowed you to lift the one side to allow any excess pressure out, but it wouldn't allow anything to suck
Uh-huh.
in.
Makes a check valve.
It makes a check valve.
Makes sense.
So you don't want any air getting sucked into, sucking chest wound, into the chest cavity.
And that's what
These are a lot nicer. This will typically place right over the wound, and they probably gave you 2 of them.
They did.
Hey, good guess. If you had an entrance and an exit wound, you place one over each,
Right.
and it would allow air to come out, but not to go back in.
That makes
So
sense.
that's where you're gonna use your vented chest seals for that application. And these are very common in trauma kits nowadays, for when you have a penetrating injury to the torso.
Right.
So, yeah, nice little kit so far. What else you got in there?
Well, we got a little blanket here. I understand about this, but I'd like to explain it anyway, and that is it's made out of Mylar.
Mylar
It's a
survival blanket?
Survival rescue blanket, yeah,
Okay, keep the person warm.
right.
I don't wanna get them hypothermic.
Are there any other shock treatments that are commonly used, other than just keep the patient as warm and comfortable as you can?
Keeping them warm, elevating the leg still works for somebody in true shock, and it depends on what type of shock that they're in. Hypovolemic shock from bleeding, that person needs fluids.
Right.
Whether it be a whole blood product, IV, saline, etc. There's a lot of factors that go into it. Now, if you're out on your camping trip in the middle of nowhere and you don't have rescue available immediately, now you're gonna have to kind of see what you can do. Did you stop the bleeding? If it was a bleeding incident, are you keeping them warm? Are you keeping them as calm as possible? Because the faster their heart rate beats, the faster that they're bleeding, the faster they could bleed out.
Right.
Keeping them warm, or if you need to wrap them like a back-baked potato, the survival blanket's it.
Yeah.
That's really all you have in that situation, unfortunately. Or using body heat. I think I saw that in a Star Wars movie. If there's an animal that they can cuddle up to, that'll help keep them warm also.
Yeah, in a freezing situation.
I did see that in a Star Wars movie, for sure.
I just heard something the other day that this really has nothing to do with what we're talking about, but it was really interesting. I was talking to this guy, and he said that Cheetos, the puffed Cheetos, make great fire starters.
I don't have one to test that,
But I intend to do a video on that and prove the point or disprove the point.
okay,
But it's interesting. I mean, they got a lot of oil in them.
yeah.
It seems to me it would work. But
In my
I don't
camping
know.
kit, I have cotton balls that are dipped in Vaseline.
Makes sense?
So if you have a tinder and you can get a spark, that'll
Sure,
light up
yeah.
quickly.
Yeah,
So, yeah, very cool.
I like that. You know, I went through a survival class and I learned that I can indeed eat earthworms.
Okay.
I learned that. But I can tell you this, you're better off if you don't chew, just swallow quickly. Because you'll never get that taste out of your mouth.
Hey, you said it on camera, I didn't.
Hey, we're trying to have some fun here too.
Oh, absolutely. Well, let's take 5.
All right.
We'll get a drink,
Sounds good.
stretch our legs a little bit,
All right.
and then we'll get back to your kit. Oh,
good.
man, I see some good stuff in there. Yeah, we'll be back here momentarily.
All right. We'll see you in a bit.
So let's get back into our
Yeah.
first aid kit.
Absolutely.
Get your backpack in here so we can see. That's what you carry. That's why we're not opening your stuff.
Right.
I'm opening things that are similar.
Uh-huh.
So an emergency bandage.
Yeah.
I have it right there.
Okay.
Show it on camera.
Mm-hmm.
It even has instructions on here, so it's firefighter proof.
Right.
Which shows direct pressure, wrap it around, clamp it in place.
Uh-huh.
In an emergency situation, those instructions are going to be useless because we're going to be panicking and you're going to go, oh, stuff.
Uh-huh.
I see, I actually avoided profanity for a change.
Well, you used the S word, it was just a different one. Yeah.
So we'll open up one that's similar. This one is from, shout out to, I don't know who I'm shouting out, Tactical Medical Solutions.
Ooh. There you go.
And these are expired, so that's why we can open these up.
Right.
We'll just throw that in that wastebasket over there that doesn't exist.
Right. Yeah, I saw that wastebasket, the open air tag.
So these are, and as you saw, is a nice vacuum sealed package.
Right.
But when you open these up, it almost looks like a giant diaper if you were going to describe it as anything.
Uh-huh.
But a lot of padding to be able to apply pressure, and you'll see it has this like eye cup on the top.
Uh-huh.
That, in addition, is to hold pressure down onto a wound. Now, to use this on yourself, probably going to be a little bit of a pain.
Okay. Well, got something right here.
But, as you see, there's a Velcro piece here,
Uh-huh.
that cushioning, and when you put this on, you
Okay.
hold that up,
Right.
so direct pressure, wrap this around,
Uh-huh.
it's going to Velcro into place, and then you can continue wrapping that tight.
And that'll tighten it up even further.
And that'll tighten it up. You tighten it
Right.
up in the next pattern, keep wrapping that.
Uh-huh.
Move the bag.
Move your bag.
Yeah.
And you can feel the pressure.
Yeah, I can feel it. You can
On
actually
there.
see it in the veins in the back of my hand that
Right.
it's tightening up.
So wrapping it over that little cup is applying pressure onto the wound. And I'm not going
That's
to wrap
great.
you up all the way.
Yeah.
But little emergency dressings like this are fantastic.
Yeah.
And a lot of them are designed where you can actually pull the stuffing out of them as well if you needed to. If you had to pack this into a wound.
Okay. Yeah. Wow.
So you could take that out if it was an abdominal wound, etc. This is what you had.
Yeah.
And you could use this gauze for whatever you needed.
Right. Right. Well, that
So
makes sense.
a pretty versatile dressing.
Kind of like
So
an
this one's going to
all-purpose
be
thing.
very similar.
Yeah.
And yeah, cool item to have.
Yeah. Those are very cool.
Yes, sir.
Question, if you start with one and you find that there's something else better, is it better just to leave that in and not use the other stuff?
So the question, if one worked better than the other, or
Right.
say somebody's bleeding through that one.
Right.
Direct pressure is our first goal. We bandaged it. We noticed that it's still bleeding. The next step would be to leave that in place, so that way any clotting that's happening under that bandage continues.
Don't.
Wrap another one on top of it.
Okay.
I would check for circulation, make sure we're not cutting off circulation completely. You can pinch the nail beds. Does the color still return within 2 seconds? Can you still feel pulses? You'll be able to check for circulation, but if it still bleeds through a second dressing, you're going to consider a tourniquet. If
Yeah.
it's uncontrolled bleeding, all bleeding stops eventually,
Right.
whether either by us controlling it or if they bleed out.
Right.
So great item to have in there.
Mhm.
What else is in your kit?
Well,
Check this thing out.
I think that's about it for
That's it. That's out of
for
the
the trauma
gunshot.
kit. Yeah. And the rest of it is just a general first aid
Those
kit.
shears are fantastic.
Yeah. So tell us about these shears and what these shears can do for us.
Well,
They're not big enough to cut my cameraman's head off.
no.
They won't do that.
You have a lot of hostility toward your cameraman.
No,
why
we
is
just
that?
like to bust on each other.
Oh, okay.
You should hear the things he says about me.
Yeah,
All right,
so
Twigs, we'll talk about that later.
these are safety shears, so they're made so you can come in contact with the skin and still use them, and you're not going to cut the person. So they are designed as safety shears. Mainly, I've used them for cutting clothing off of patients, especially a traumatic injury patient. Depending on what the trauma is from, rule number one is to expose them.
Yeah.
We want to see where the holes are, where the cuts are, what bruising is happening, so we can kind of identify what injuries we're dealing with. So cutting their clothes off is step number one. Cut straight up the sleeve to the neck, cut the other sleeve,
And it just comes
and
right off.
potentially right down the center of their shirt. And these are better to use than a pocket knife, something like that.
Yeah.
I've used these to cut an Air Jordan on a guy that broke his foot. He was probably upset that I didn't take it off nicely, but I had to get his shoe off, and that was the best way to do it without manipulating his foot.
Yeah.
So they're great to have.
Yeah, it's fantastic.
So,
They're very sharp.
Yeah, I was thinking
They're
that
sharp
might be
enough.
what they were for, yeah.
yep, they're for cutting off clothing. So whether it be recreationally or professionally.
Yeah, I like that recreational clothing remover, yeah.
Well, you gotta have a hobby.
You know, well, yeah, I mean, we're probably not the first guys to think of that, but.
Hey, you picked me for this conversation.
I did,
so,
I did.
you know,
It's my fault.
You
I
chose
admit it.
poorly.
I admit it, I chose poorly. All right, so,
I think you did good.
once again, shout outs to Sunshine here, Sunshine Safety. They really hooked us up here with this stuff.
They did. They did put together a great package. I have a couple of them available.
So.
Oh my goodness! Oh, so many goodies.
We have some of the same goodies that were in the other one, the little pen, which you thought was pretty adorable, those tiny pens.
It's a fantastic pen.
They have a little flashlight in here, a little pen knife.
A little pen light?
Yeah.
With a pupillary gauge on it.
Right, to show you.
Yeah, so you can actually see if somebody's pupils are constricted or dilated.
Mhm.
Because when the paramedics get there, you can say, hey, his pupils were 2 millimeters, and
Yeah,
that's going to clue us into what might be going on with the person.
yeah, in case of head
Versus
injury.
9 millimeter, the person that's been at South Beach all night and their pupils are well dilated, we might have
Yeah.
another assumption as to what they were doing.
Understood.
So the pen light's handy
What you mean without a breathalyzer?
without a breathalyzer. Yeah, and they actually give you an inventory card on this also.
Yeah,
So good to always check your stuff. Another set of gloves in here, 2 sets of gloves, some tweezers. What else we got in here? Some liquid skin, fantastic. So this is a nice outdoors kit.
yeah.
You're out camping, this would be something great to have with you. And elastic bandages in here. So these are great for bleeding control.
Yeah, 'cause
Spraying
they apply pressure.
strains, bleeding control, immobilizing a broken wrist. These are fantastic. So, a makeshift splint in the middle of the woods, you might have to have a stick and secure it with an elastic bandage. So they throw in a couple of those. There is some cling. This is a simpler version of what's in that vacuum sealed kit.
Okay.
So this is probably a less expensive option. They call it a Dyna stopper. But you can see it's a pad on the back with 2 pieces of cling
Uh-huh,
that you can use to wrap an injury.
okay.
These are fantastic, and most bleeding control can be done with something like this. We talked about the tourniquet earlier, but items like this are fantastic to have in a kit.
Yeah, they have some little guys in here to clean yourself up with.
Oh yeah, a little Purell, hashtag COVID. Make sure you're sanitizing.
Right.
Alcohol prep pads, you'll never use those in a first aid setting. Cleansing towel, you might clean an affected area
Right.
prior to bandaging. You get a lot of dirt in there. That's why they also have a sterile water in there. You could potentially irrigate an injury site
Right.
prior to wrapping it. Or if you got something in your eyes, this would be great to have.
Yeah.
So copious amounts of water.
Yeah.
But yeah, there's a whole drug kit in here. Look at this.
Yeah.
Way to go, Sunshine.
Yeah.
They got Benadryls in here, Advils, some antibiotic cream, Tylenol for fever control. What else is in here? More Purell. What was I looking for? I was looking for aspirin, I bet. Medalite, don't know what that is.
Okay, aspirin, what would be the use for the aspirin? Would that be for like,
So the
Heart attack,
aspirin
or-
is in there for a suspected myocardial infarction or heart attack, more commonly known as. And the first thing that's missing out of every first aid kit is the aspirin.
the aspirin?
Because everybody takes it when they have a headache or a backache or something like that. Oral pain relief. I don't see aspirin in here. We might want to throw some in there.
Yeah.
Or I'm just missing it. But the aspirin is the number one thing that a healthcare provider is going to give somebody, as long as they're not contraindicated, they don't have any bleeding disorders, things like that, known allergies. Aspirin is an antiplatelet, so it's actually going to keep any clots from getting worse.
Okay.
So even in a paramedic setting, the number one medication we give people is aspirin. 324 milligrams or 4 of them. In the first aid class, they teach to give 2, which is fine. But yeah, absolutely essential to have in your kit.
Okay, so I know we said antiplatelet, which those are actually called thrombocytes. Thrombocytes release a chemical called thrombin, and that's the actual chemical that causes the blood to clot.
Okay,
Believe it or not, I actually remember that from high school biology.
alrighty
Amazing.
then.
Yeah, so I did actually learn something in the class.
Excuse me.
I know that it shocked all my teachers. They would never believe I learned anything, but I did.
Oh, nice.
So,
Nicely done. And a lot of people, and that's why I say antiplatelet is a lot of people use the term blood thinner, which it is not.
Right.
So that's an incorrect term, and that's why I don't use, that's why I specifically say antiplatelet.
Right.
We got an assortment of Band-Aids in here. Let's see. Do I need to show you how to use a Band-Aid?
No, I
Band-Aid?
actually used one of those a while ago.
Yeah, triangular bandage can be used for a lot of splinting, especially a shoulder injury. Dislocated shoulder, a break in the forearm, etc. You can use this triangular bandage.
Okay.
And I recommend, even to our EMT and paramedic followers, take a look at how to tie a triangular bandage, because it's the first thing that you forget how to do if you haven't pulled it out in a while.
Yeah.
It makes a giant triangle. You friggin' tie a knot at the one end, and then put that knot at the elbow and wrap and immobilize somebody's arm. But I've seen some interesting methods of applying triangular bandage in the past. But a great thing to have in there, there's a flare in here. In case you're gonna go to a rave party, they have a light stick in there.
There you go.
I don't know how many raves you're going to.
I've been called a raving lunatic a time or two,
But no rave parties for you?
but mostly by my wife.
And 2 sets of gloves.
2 sets of gloves. And they're the really cute ones too.
They are, they're
Yeah.
adorable.
So if I put 3 of these things on.
I believe you're not supposed to put more than 1 set on.
Uh-huh.
They don't recommend that.
Okay, and why is that?
I don't know why. I think I was taught that in paramedic school, and it's one of those things I've just never put more than 1 set on, ever.
Uh-huh.
So I'll have to look into that. I could lie to you, but
No, I'm just curious about that because I had never actually heard that.
yeah, I've heard other forms of contraception that you should not wear more than 1 of. So maybe along the same lines
Maybe so.
goes with your latex gloves
Maybe
or
so.
nitrile gloves.
Yeah.
I apologize.
Yeah.
Because if somebody is allergic to your latex, that's why most kids nowadays all have nitrile gloves, and most paramedics only carry nitrile gloves.
Yeah. Now,
lot of
back in
people
the
are
day, we didn't really realize that there were so many people that were allergic to. And so what you ended up with back in the day, they were all latex gloves.
Yeah.
But again, like I said, this is the difference between 40 years ago and today. We've learned a few things. you
Maybe.
know, And some things we haven't.
But a lot of things stay the same.
You know, you were talking about, the minute you said it, I told you I didn't know anything about the chest seal,
Mm-hmm.
and I knew, but I had completely forgotten. Because it was so long ago, I
Yeah.
just did not remember. So this is probably something that we should refresh our memory on a regular basis.
Right, and that's why the American Heart Association, and I'm not shouting out to them specifically, I'm sure Red Cross and other agencies recommend the same every 2 years, going to the class, getting recertified.
Yeah.
Because there's a lot of new things out there. Like even as an instructor nowadays, I'm talking about administering Narcan in the non-healthcare profession setting because it is so common.
Yeah.
People are using medications that are causing them to overdose, they're causing respiratory depression, and you can buy naloxone, Narcan, same product, just a different name. You can buy it at Walgreens. You can actually buy it on Amazon. I think it's like $35.
Back in the day, I went to a wedding, and I had had a sore throat, and I had been taking tetracycline. And what I didn't realize was how badly that stuff would potentiate alcohol.
Oh,
I had one of those plastic cups of champagne, and I was so potted I could barely walk.
do you have any tetracycline with you now?
No.
Oh, okay.
Darn.
No, never mind.
But yeah, so anyway, mixing drugs is never a good idea. I mean, because you don't know how they're going to react with each other.
That's true.
If you have a question, contact your pharmacist.
That's absolutely
They
true.
usually know.
Or if you mess up bad enough with your drugs, call poison control.
Yeah.
Poison control is a great resource that a lot of people forget about, especially your followers that have children. Poison control is a fantastic resource. Their phone number is 800-222-1222. You can look it up on your smartphone. Everybody has a smartphone in 2024. And call them, hey, my child swallowed a bottle of blank.
Right.
And they'll point you in a direction. If it's something that they need medical attention, they will tell you, get them to the hospital immediately. They might tell you to call for EMS. And once that happens, they'll actually contact the receiving hospital and give them a treatment plan as well. So it's a team effort with the hospitals to call poison control. And having that number in your bag somewhere is important, on your phone. You might not have a satellite, or you might not have phone signal when you're out in the sticks, but if you do, it's a good thing to have.
It'd be a good thing to put on a little business card or something, just stick in your kit with you to have that information with you.
Maybe coming soon from Thin Red Line Tactical.
Well, there you go. I like that. So are you guys going to start building first aid kits also, or?
I thought about it, and surprisingly enough, and this will be a shout out to the people that actually made this kit, it is so expensive to put a kit together. I priced out tourniquets and the bandages I would use, and these are, as a paramedic, I keep it subjective to me and what I'm doing. I'm a hunter. My first aid kit in my bag is about that big. I have what I want in there, and even that's over $100 worth of stuff.
Yeah.
So people, they say, oh, $30, $40 for a first aid kit. You get what you pay for.
Yeah.
This shooter kit that they included there, with the tourniquets, with the chest seals, with the emergency bandage, you're at $60, $70, $100 in no time. So I did think about putting some together myself. The bag itself is the cheapest part.
Right.
But you know what? I'll help people if they want to talk about it. Hey, what should I put in mine? Here you go. Here's some great things to have for what you're doing.
Yeah. Yeah. Well, I'll tell you, this has been really, really informative and really helpful. Whenever you get into a situation, you always have to look at the possibilities of what could go wrong. Now, good thing for me would be if all this stuff made its expiration date and never got used. I'd be perfectly happy with that. Just replace the whole kit. Don't worry about it.
Yeah.
I'd be tickled pink. But if it ever does happen, and I have to have that stuff,
Priceless.
It's priceless, and I'm going to be darn grateful to have it. So
You really will be, and everybody, depending on what your hobbies are, what you're into, make a first aid kit specific to you.
yeah,
Your corner store drug kit or first aid kit, that's $10. If you're a shooting enthusiast, if you are an outdoorsman, if you're a saltwater fisherman, that kit's probably useless.
yeah,
It's got 4 Band-Aids in it and maybe a couple pieces of gauze.
right,
So invest the money, because when you need it, you're going to want to have it.
yeah. It's unbelievable that a lot of people they don't really think to take these precautions because I'll never use it. But what about that one time?
That's it.
And it doesn't even necessarily have to be myself or my cameraman. What if I go there to the range and it's you, and somebody did something stupid and you got shot?
Yeah, absolutely.
If I have it on hand, if nothing else, I'm one step closer to keeping you alive than if we have to wait all that time until the fire department finally does get there.
Well, and that's why the
Because-
stop the bleed's so important.
I mean, they do so good on the time. You guys are amazing on getting there quick and taking care of the problem. It's wonderful to have you. You're a great resource and we always appreciate you. But if you're that time sensitive or if you're bleeding out, I'm telling you, it can only take, I mean,
A matter of minutes.
a matter of minutes and it's over and there's nothing you can do.
We're limited to what we can do as to what we have when we get there.
Right.
If somebody's bled out, there's very little I can do.
Yeah.
So the same thing goes, we'll have a conversation at a later date about CPR topics if you want.
Sure.
You know, early access is important, hugely important.
Yeah.
And a lot of times a bystander having the right equipment is the difference between whether that person walks out of the hospital or not.
Yeah. Yeah.
So it's a good thing you have there.
Well, Mike, thank you so much. We appreciate it.
I appreciate you.
I look forward to doing more things with Thin Red Line Tactical.
Appreciate you.
I'm Bill 1911, and we'll see you guys next time.
I'm Mike at Thin Red Line Tactical.
All right. And we'll see him next time, too.
Have a good one.
Hey, everybody. Bill 1911 here. Hey, listen, if you're watching this video, if you're enjoying it, don't forget to hit that subscribe button, okay? That's really important to us. And make sure you like us. And by all means, come to visit us at askbill1911.com.